Hi, my name is Seijiro Goya, and in this video, I will demonstrate a technique for arterial blood sampling via the dorsal pedal artery in conscious small bleed ducts to help diagnose hypoxemia using minimal restraint. The authors have nothing to disclose. Arterial blood gas analysis is considered the gold standard for diagnosing hypoxemia. Single arterial blood sampling is performed by puncturing either the femoral or dorsal pedal artery. Typically, sampling from the above two sites is performed in lateral recumbency. However, in cases of hypoxemia, maintaining lateral recumbency can further compromise oxygenation. Dorsal pedal artery blood sampling can be performed with the patient in an upright rather than lateral position, which in many cases allows for less restraint and easier breathing in rhythmic ducts. However, this method can be challenging in conscious small bleed ducts and requires some tips and adaptations. The purpose of this video is to describe an alternative method of arterial blood sampling in conscious small bleed ducts with suspected hypoxemia. The materials required include absorbent cotton, alcohol swabs, clippers, an arterial blood gas syringe, a 25-gauge needle, self-adhesive elastic bandages, a topical local anesthetic cream, a bedside blood gas analyzer, and specialized cartridges. We will clip an area of approximately 2 cm by 2 cm on the medial side of the metatarsal bone and clean the puncture site with an alcohol swab. In non-urgent cases, local anesthesia should be used. We apply up to 0.5 grams of topical anesthetic cream to the arterial puncture site, covering it with absorbent cotton and a self-adhesive elastic bandage for about an hour. Subsequently, any remaining cream is wiped off with cotton, and the site is disinfected with alcohol swabs. In urgent situations where waiting for an hour is not feasible, this step may be skipped. The patient should be held in an upright position and not in a supine or lateral position. For large bleed ducts that cannot be held, blood sampling can be performed in sternal recumbency or sitting position. The restrainer must avoid compressing the proximal arteries during the procedure. To prevent the duct from moving its limb during the arterial puncture, place your index finger against the heel of the tiger leg to stabilize it. If the dorsal pedal pulse is weak, flexing the tarsal joint can help enhance palpation. Gently palpate the area to trace the course of the artery. The artery is often medial and runs parallel to the visible dorsal pedal vein. The restrainer must not compress the proximal arteries during the procedure. This diagram shows the course of the dorsal pedal artery and vein in an actual small bleed duct created based on computed tomography images. Arteries are shown in red, and veins are shown in blue. The dorsal pedal artery is often medial and runs parallel to the dorsal pedal vein, which looks like this. For clarity, only arteries are shown in the video. The dorsal pedal artery becomes a perforating metatarsal artery as it enters the distal end of the intermetatarsal channel between the metatarsals. When performing the arterial puncture, the course of the dorsal pedal artery is located by palpation with a finger. The puncture site is identified by the blue dotted line immediately before the branching of the dorsal pedal artery. If the puncture site is too distal, the patient may experience of increased pain. Blood sampling is difficult if the site is proximal, purple dotted line. The dorsal pedal artery is lifted away from the metatarsal bone as it approaches the tarsal joint. This makes it harder to insert the needle horizontally. and increases the risk of penetration through the vessel. A heparin syringe with a 25-gauge needle is inserted with a bevel up and advanced horizontally under the skin toward the dorsal pedal artery, taking care to avoid contact with the metatarsus. Once the needle enters the arterial cavity, blood will spontaneously flow into the syringe. At this point, there is no need to apply negative pressure. A heparin syringe with a 25-gauge needle is inserted with a bevel up and advanced horizontally under the skin towards the dorsal pedal artery, taking care not to hit the metatarsus. Once the arterial blood begins to fill the needle, hold the tip still and wait until the syringe is filled with the required amount of blood. As you've seen, you don't need aspiration of the plunger. After obtaining the required amount of blood, withdraw the needle and apply pressure to the puncture site with a self-adhesive elastic bandage for at least 5 minutes. Arterial blood gas analysis was measured using a blood gas analyzer and a cartridge. In this case, the PO2 was 66 mm mercury, indicating mild hypoxemia. Thank you for your time.